The first one is the winner of our contest, just for signing up for our blogs and our Facebook page and our social networks.
They're getting Botox.
Yeah, they're
free
gonna,
Botox.
Yeah, they're going to bring in a friend. One of them is going to get free Botox.
Or they both split it and pay
We're
back.
going to email you tonight. Your name begins with an R.
We can't announce your full name or email address for HIPAA reasons. We just want to protect ourselves. But whoever you are that begins with an R, look in your emails tonight, people.
Okay, good. And then the other thing is just today, Artifil, the makers of Artifil, announced that they're going to allow me to offer buy two, get one free syringes.
Artifil. That's
Artifil.
major.
That's
a
major
$1,000 savings.
So if you buy 4, you get 6. If you buy 2, you get 3. And that's really big. And that's through the end of December.
That's awesome. And they're, of course, one of our sponsors of the show.
Yes, a generous sponsor of our show. Thank you very much.
And iFlow. Thank you.
iFlow is the other sponsor of our show. And just today I had a patient come in who is going to get a removal of her breast implants and replacement with others. And she's a personal trainer. And she's asking, you know, I need to get back to work pretty fast. And a lot of getting back to work is dependent on how much pain you're in. So I told her, you're going to get this pain pump, which is really going to help you a lot. So thank you, iFlow. Yes, she was very happy.
And thank you, Artifil. And everybody, seriously, now is the time. This is through the month of December. Stock up on that Artifil because, man, is it good, and it is very expensive, but it's well worth every penny. I can't believe they're giving this to Dr. Ronell's patients.
Well,
that's awesome. That's because that's because you patients out there have been very supportive of Artifil, and they're granting you a favor because of it. So thank you.
Thank you.
Excellent. All right.
So later today we're going to hear about a nutritional tip from Mark Wood.
Seasonal eating.
And I thought that today we'd just do more listener emails.
Yeah, well, we promised everyone more of the emails, so let's get to it, shall we?
Okay.
All right, and I like never reading these before, so I sort of go with the gist of the way the people write them. So here we go. Hi, this is from Delilah. Hi. I wanted to get a breast lift because due to having 3 daughters and breastfeeding all 3, my breasts kind of sag. I'm only 25 though. Do you think it's a good idea to get a breast lift this young?
That's a great question. What do you think? I think yes, but you know.
You know, my thought is, I mean, she's already got 3. That's a lot of kids. God bless you. But she's also young. Life has not even happened for her yet. If she wants more children and her breasts get engorged with milk and hormones, etc., what does that mean?
It might sag again, but I think it's unlikely to sag as much because you're going to have less tissue. You'll have some scar tissue to hold it back. Excuse me. But also, she is young, and why should she be unhappy?
Oh, no.
Right. I mean, why delay gratification? So I say, sure, that's fine to go ahead and have a breast lift.
But she says they kind of sag. So I would say you need to examine her and then really go over it with her. Because the kind of sag versus what I had, which I would call sagging, is different. It might be something you could tolerate, Delilah, for a little longer.
Or if they just sag a little bit, it's a very
implant.
You can do an implant, or you can do a minor lift, a procedure. It's practically in the office. It's a little excision of a crescent of skin.
Right.
Crescentic excision of skin.
That's what I wished I could have had.
Yeah, and that's just, you can even do that in the office. So
I'm older than you, Delilah, so I couldn't get it.
Right. So there's really no age limit on plastic surgery.
Well, nobody operates on children if they can help
Well,
it.
obviously.
Right.
But you know, there are teenagers who come in, for example, who have body problems, like for example, if a young woman hasn't had a developed breast, or if a young boy has gynecomastia, overdeveloped breast,
or if girls have overdeveloped
I'll do
breasts.
something I'll do something on them with with their parents around and with their parents' permission.
No, of course. What about nose jobs for kids? Just to go off our path a little.
It depends how young they are, because noses change a lot. There are some noses that are really cause airway problems and obstruction problems, or obviously cause emotional problems, and then sure, they can be candidates too. They just, you spend a lot of time counseling them and speaking to the parents.
You have to, absolutely.
About that.
The boy, when I was 16, I would have been so happy with a nose job, and I waited for mine until I was, 27?
Yeah.
That was a long 11 years, and I was miserable.
Yeah. Yeah.
I still look good, but I was
I've seen pictures of you in high school, and I wish I'd known you back then.
boy.
All right.
Thanks a lot. Okay. All right, next. Who's the next lucky email? Okay, we have Deb. I was wondering if you do breast reduction by liposuction. Also, do you know the requirements for insurance to cover such a procedure? Thank you. Excellent question.
That's a good question.
Yeah, rare question.
In the past few years, there have been some reports of breast reduction by liposuction started out in Japan. And the long of it, or the short of it, is that you cannot take a lot of breast tissue out with liposuction. Liposuction is really for spot areas, and if there's a spot area like on the lateral part of the breast, for example, that can have liposuction. But why do people have breast reduction? Normally because their breasts are so large that it's really pulling on their back and it's interfering with their ability to exercise and buy clothing. And so you need to really reduce a lot of that breast size. You cannot just do that with liposuction, mostly because there's such a big skin envelope left over. So the insurance companies will not cover breast reduction by liposuction, certainly not.
But the signs, this is a great question, the signs for insurance being able to cover breast reduction are what? They're very simple.
Right, you have to, almost always we have to submit a picture so they can just verify that the breasts are big for the person's frame. And you need to have back pain, shoulder notching from the bra.
That indent that we get from your bra, right?
Having,
that's awful.
a woman needs to have seen their primary care doctor about 6 times in the past year for breast-related issues, such as back pain or a rash under the breasts, or, having seen a chiropractor or a physical therapist for back pain is also helpful. And some insurance companies are more lenient than others. Some insurance companies are very difficult, and they actually have this secret formula where they put in the patient's age and their weight and their height and the measurements that I report to them, and if you don't match the formula, then they won't cover it. It's really annoying.
Those insurance companies, man.
Because all of the studies have shown there is no correlation between the amount of breast tissue removed and relief of symptoms.
Right.
So if you take 200 grams out from a breast and you take it out of the right part of the breast and you still let the breast look very nice, they won't cover it, and it'll still relieve the back. Right, and so you end up having to take off too much tissue. It's not fun.
That's not right. We are not fans of the insurance companies.
Yes, we will have to continue this
once again.
Right, after our break.
Yeah, we'll continue it again. Okay, good. We'll be right back.
Yes, thanks for listening to Talk 1260 KTRC. This is Dr. Ronell,
and
my
me.
wife Betsy Ronell, and
The one and only.
we'll be back in a few moments with a nutritional tip from Mark Wood.